All right, I'm here with Dr. Morris, Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. So the arthroscope's in the front. You're laying on your side, and now we're just getting our first look inside the joint. Right off the bat, we can confirm that this biceps tendon anchor is torn and frayed. And so we're going to go ahead and release it just like we talked about and reattach it in a different part of your arm. Okay, so as we focus a little bit, we're using this instrument called a shldr just to smooth out some of the rough areas. Trying to find something to focus on here. Maybe a little better. Let me stop the shldr. Hold the shldr there, please. Yeah. This focus are too tight. Okay, so now we're going to go ahead and smooth out this labrum that's a little bit frayed also. So you've got some arthritic changes in the joint, and because of the magnification of the arthroscope, we can see that. You can see how the socket's not exactly smooth anymore, and the labrum is pretty much frayed all the way around the joint. Okay, so we're going to go ahead and look at the rotator cuff, which so far looks pretty good at the top of the screen here. Okay, let's go ahead and put the camera in the front for a minute. Pause, please. Hold it. Okay, so we're just looking from the front to the back. I'm using our shldr just to further smooth out some of these areas on the glenoid. We can look all the way down towards the bottom of the shoulder. And I don't really see much else to worry about here. It's about as smooth as it's going to get. So we're done inside the joint. We're going to go ahead and have a look at the bone spurs up above. Pause, please. Okay, so let me show you where we're at. We've smoothed out the acromion, which is the bone that makes up the roof of the shoulder. Right up here at the top of the screen, that looks good. Your rotator cuff down below we've looked at, and it looks good all the way across. No signs of any tearing in the rotator cuff, so that's a good sign. And now we're going to go ahead and finish up our decompression of the AC joint of the clavicle. We've already started. And we're about to put the burr in from the front to finish the job. So let's go ahead and do that. Leave this in. Pause, please. Make sure this is draining in the back. Okay, so now we're looking at our burr coming in from the front. This is the clavicle on the left. And we've got pretty good space now between the acromion and the clavicle. So we'll get that picture, we're going to flush it out a little bit, and then we'll show you some more. Pause, please. Okay, just hold it. And we're just about done. So now we can see we've got more than 6 or 7 millimeters, probably closer to 8 or 9 millimeters. Space between the clavicle and the acromion. So we're going to finish up on the arthroscopic portion of the case and get to work on fixing that bicep. So I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.